So I think, given the expertise in the room, the background to the research that I'll be talking about I can keep fairly brief. So we know, of course, that mental toughness predicts lots of different mental health and well-being type outcomes. So there's lots of literature showing that it's related to stress, to well-being, to life satisfaction, to depression, to anxiety, and also things like recovery from mental illness. And of course, we also know that there's certain professions in which individuals are at an increased risk of poor mental health and well-being outcomes. So one of these populations at a higher risk is, of course, first responders. So there is research looking at police officers that has shown that they're at an increased risk of experiencing stress, but also burnout and something called secondary traumatic stress. So these are all concepts that I'll be touching upon today. And there is a bit of research, but not quite as much, looking at fire officers as well. And so that research also suggests that this is another population at an increased risk of experiencing stress and mental health difficulties. These populations are at an increased risk for several reasons. So, of course, one of those reasons is related to the nature of the roles themselves. So first responders have to deal with lots of unexpected and lots of difficult situations. But some of the difficulties they experience are also related to things like shift patterns. So there is work suggesting that those who have to work shifts experience more mental health difficulties than those who do not have to work shifts, for example. So the work that I'll be talking about then just aimed to examine whether mental toughness can play a role in mental health and well-being within these populations. Of course, it used the mental toughness framework that everybody is really familiar with now, so I've shown that on the slide, but I don't think I need to say anything else about what mental toughness is. And most of the research used the Mental Toughness Questionnaire 48. So hopefully if you hear me talk again in the near future, I'll be able to talk about work using the MTQ+, but it is the MTQ 48 that was used for most of this research. So the first piece of research that I'll talk about briefly was really quite an exploratory study just to try and demonstrate that there is a role for mental toughness within these populations. So I carried out a study which was published back in 2017, working with some students who helped to collect the data. And we asked a sample of police officers and also fire officers from UK forces, particularly those in the northeast of England, to complete an online questionnaire. And the questionnaire was just comprised of the perceived stress scale that some of you have probably come across before, and of course the Mental Toughness Questionnaire 48. Participants were also asked to report some demographic information, so related to their age, their rank and their length of service, for example. Now this in part was motivated by one of the more theoretical things that I'm interested in surrounding mental toughness, which is the extent to which it can be developed just through experiential learning. So I think there's some interesting questions that can be asked about whether more time working in one of these professions or perhaps being at a higher rank within one of these professions might actually lead to changes or differences in mental toughness compared to other people. So I will touch upon that a couple of times within the talk. So just to briefly talk about some of the results then, but as I mentioned, not showing you too much data and too many graphs and things. The findings, as you might expect, based on lots of the things that we've heard about yesterday, did show that in both police and fire officers, mental toughness was a significant predictor of perceived stress. So it accounted for approximately 60% of the variance in perceived stress. So this is quite a good predictor. And although all of the components of mental toughness were significantly correlated to perceived stress, we then looked at the components that were particularly important And as you can see on the slide here, these were control of emotion, control of life, and confidence in abilities. And control of life actually seems to be one that is particularly robust across lots of different studies. So in quite a lot of research that I've done, this seems to emerge as being one of the most important components of mental toughness. So we did also look at whether there was a role for any of the more demographic things that we collected related to age, rank and length of service. In this study, actually, there was no consistent pattern of findings. So these factors were not related to mental toughness, but I will talk about this a little bit more. So this study then just showed us that there is a role for mental toughness, so it does seem to be important within these occupational groups. So having found this, I then carried out a second study which we published back in 2019, and the idea of this study was to explore this in a little bit more detail, to look at some additional outcome measures and also to explore a couple of additional things that we were interested in. Now, this study was carried out with police officers and not this time with fire officers. That was very much just based upon the practicalities. So in the work that I've done, it's been much easier to find police officers who are willing to take part in research. And that is because at Newcastle, we have a professional placement programme which I set up quite a few years ago now. So I have some students who go on placement with the local police force each academic year, and sometimes one of the things they can do when they're there is to carry out a research project. So this time it was just using police officers, but we also had some volunteers to complete the study who had different roles within the police force. So a lot of the participants were police officers, but some of them were volunteers, and some had civilian roles within the police force, so working in the Human Resources Department, for example. So again, in this study, we used the perceived stress scale and the MTQ-48, but this time we also asked participants to complete the professional quality of life scale. And this is a known measure which is quite reliable and valid, and it measures burnout, secondary traumatic stress, and also compassion satisfaction. So I know most people will be familiar with the term burnout, that is used quite a lot. It really just refers to emotional exhaustion and depersonalization or distancing from other people. Secondary traumatic stress might be a term that some people have come across before. This overlaps a little bit with post-traumatic stress disorder, but instead of resulting from experiencing trauma yourself, this is something that comes from working with other people who have experienced trauma. So of course, if we think about the work of police officers, this is very relevant because they'll spend a lot of time supporting people who might have been victims or perhaps perpetrators of crime. The other measure in that is then compassion satisfaction, which is quite an interesting construct. And this refers to some more positive aspects of police work. So compassion satisfaction describes a feeling of reward or pleasure or perhaps a sense of purpose that can come from helping other people. And what is important to note about this is that it is not just the opposite of burnout or secondary traumatic stress. So you can be quite burnt out, but yet also manage to experience some compassion satisfaction. So they are considered to be separate constructs. So again, in this study, we asked for some other information from participants. So we asked about the demands of their role, and we asked them for some demographic information. And then in this study, we also asked participants to tell us about what steps they took to look after their physical and mental well-being. So we didn't use a kind of existing measure for this. What we did is we just created as comprehensive a list as possible of all of the different types of strategies that individuals might use to take care of themselves. So this ranged from things like physical exercise and healthy eating through to techniques like using mindfulness and relaxation strategies. And then participants just selected all of the things that applied to them. So to talk briefly about the findings from this study, as you very much might expect, mental toughness, of course, was a good predictor of all of the outcomes. So it accounted for approximately half of the variance in perceived stress and burnout. So again, it seems a really, really good predictor. And then it accounted for about 1/3 of the variance in secondary traumatic stress and compassion satisfaction. So of course the findings were that mental toughness, higher levels of mental toughness rather, were related to lower levels of perceived stress, lower levels of burnout, lower levels of secondary traumatic stress, but then higher levels of compassion satisfaction, which is this positive aspect of police work. We were able to then look at this alongside any features of the individual's roles within the police force that might be important. And one of the interesting findings here was that the requirement for shift work was also a really important predictor of all of these outcome variables. So individuals who had to work shifts compared to individuals who did not have to work shifts reported higher levels of perceived stress and burnout and secondary traumatic stress and higher levels of compassion satisfaction compared to their colleagues. And another interesting finding here was that mental self-care activities, so that's the things like mindfulness and use of relaxation strategies, that was also a good predictor of burnout and secondary traumatic stress. And I'll come back to say something else about this particular finding in a minute. So the findings that I've just summarised there were the findings that we focused on in that paper that was published. But what I wanted to do today is just to pick out a couple of additional findings that really we didn't have the chance to consider quite as much in that published work. And these relate to some of the theoretical issues which I'm quite interested in about mental toughness. So the first finding was related to the pattern of results for shift workers versus non-shift workers. So they had higher levels of perceived stress and burnout and lower levels of compassion satisfaction, but they didn't differ in terms of mental toughness. So I think one of the things that this relates to is the idea that sometimes is discussed in the literature, which describes the direction of relationships between mental toughness and some of these mental health and well-being outcomes. So in mental toughness literature, we do tend to always consider mental toughness as being the causal factor. So we think about mental toughness first, and then we see outcomes as dependent upon that. Now that does make sense, and of course that has come from some of the other settings like sport that we've heard about, where we know mental toughness predicts different outcomes. But in the literature on mental health and well-being, actually something we could think about is whether the directions are more bi-directional between mental toughness and these outcome measures. So although mental toughness might be important for predicting mental health and well-being, actually what happens if we are not feeling particularly well? Might that also have an impact upon our mental toughness? So as an example, life as an academic for me has been very busy recently. So I've had quite a high workload. I haven't been sleeping particularly well for a few weeks. I think I've been dealing okay with that because my mental toughness probably isn't too bad. But actually, is this situation that I'm in at the moment actually impacting my mental toughness in terms of then how I'm able to approach any more challenges that perhaps come my way? So this finding about shift workers compared to non-shift workers, I think is quite an interesting one. So shift workers reported having higher levels of perceived stress and burnout and lower levels of compassion satisfaction, but yet actually they didn't differ in terms of their mental toughness. So arguably, if mental health and well-being impacted mental toughness, and we see in shift workers higher levels of stress and higher levels of burnout, what might have been a result of that is then lower levels of mental toughness, but that isn't actually what we see in the pattern of findings. So I think this is quite supportive of the idea that mental toughness should be considered as the kind of influencing factor of mental health and well-being outcomes. Something else that I think is interesting about the findings, perhaps not so much for everybody in the room here, because of course you all know a lot about the concept of mental toughness, is the finding that higher mental toughness was associated with more use of both physical and mental self-care strategies. So those who had higher levels of mental toughness reported using more strategies, like making sure that they had regular exercise, that they had healthy eating patterns, that they used mindfulness, that they used relaxation, for example. Now, I'm sure that this makes sense to everybody in the room, so of course you know that mentally tough individuals are better able to use these coping strategies to deal with any difficulties that come their way. But I do find that sometimes those people who are less familiar with what mental toughness really is don't really think about mental toughness in this way. So the term toughness can sometimes give the impression of being about an unstoppable perseverance, where individuals just have to carry on regardless of what happens. And perhaps it's the term toughness there that is kind of creating that perception. But actually that isn't the case. So those who are mentally tough are much better able to identify when they need to use these strategies to look after themselves, and they use these effective methods of coping, and that is how they then better deal with difficult situations. So I think this is quite interesting in terms of us ensuring that people are informed and truly understand what mental toughness is. So if one of the aims is really to progress the mental toughness concept and to use this across more settings, then what's really important about that is for people to have an accurate understanding or impression about what mental toughness is. So I think moving away from this idea that it's about toughness, which is just perseverance, is actually really important. So I talked there about work with first responders, and I started by saying that of course those are occupations in which there's known to be an increased risk of mental health and well-being difficulties. It is important to note though that of course that there's lots of other occupations as well in which there's a higher risk of mental health difficulties. So I just wanted to take this opportunity to also talk about some work in a different setting. And this was a project which was published in 2023 along with a colleague and a student who collected some data for the project. And this project involved working with individuals who were employed in mental health settings. So similar to how first responders have a role which involves dealing with difficult and unexpected situations, those who are involved in mental health care also experience a lot of difficult situations. So there is a lot of dealing with people who are experiencing trauma and difficult events, and discussion about lots of difficulties and challenges that people have faced. So arguably this is another occupation in which there might be these increased risks of mental health difficulties. So in this study, we recruited some participants who were working in mental health roles. So they were employed either in inpatient or community mental health settings. So a lot of them did have roles that involved carrying out assessments and then offering support or therapy on a one-to-one basis with clients. And we used the same measures that were used in that previous study with first responders. So participants completed the perceived stress scale, the MTQ-48, and the professional quality of life scale. And participants this time were also asked some open-ended questions about their stress in the workplace and their strategies for dealing with stress. So I will say a little bit about the quantitative data, but one of the things then I'd like to talk about a little bit more was the insights from the qualitative data, which of course is what this study did that was different to the previous studies. So in terms of the quantitative data, mental toughness again was a really useful predictor of all of the outcomes. So this time it accounted for between 45% and 57% of the variance in stress, in burnout, secondary traumatic stress, and again, compassion satisfaction. When we looked at which aspects of mental toughness were particularly important here, again, we found that control of life played a particularly important role, and this was the one that I mentioned earlier as being quite consistent across lots of studies that have suggested that this is particularly important. But interpersonal confidence here played a particularly important role as well, and this was a little bit different to some of the studies that we've done with first responders. I think this makes sense though in this situation if you think about the nature of the role that these people have. So it is about working on that one-to-one basis, offering support, offering therapy, and therefore it is that interpersonal relationship sometimes between a therapist and a client, which is particularly important. So I then wanted to say a bit more about the qualitative data. So this provided some really interesting insights into sources of stress and stress management within this population. You can see a kind of overview of this in the form of what we call a thematic map on the slide here. This is a way of summarising what participants told us essentially about the impact of stress. So just to pick out a couple of examples there, you can see that in terms of the effect of stress, individuals talked about how that led to burnout and it led to both physical and mental health difficulties. And then in terms of strategies for dealing with stress, individuals mentioned using support from other people and using self-care strategies, for example. The particularly interesting thing that I wanted to say a little bit more about, though, from this particular study was what participants told us in terms of the impact of their role upon their mental toughness. So this relates to this theoretical issue that I've touched upon a couple of times about the direction of the relationships between mental toughness and these different mental health and wellbeing outcomes. But related to that as well, the ability of individuals to use their experiences to enhance their mental toughness. So some of the participants in the study, they suggested that actually the nature of this difficult role, which seems to be very stressful and is quite challenging, had actually led to increased levels of mental toughness. So suggesting that mental toughness is something that we can develop through experiential learning. So I've just included one example on the slide here of a quote from a participant. I will read this out for the purposes of the translation here. This participant noted about their role that it has markedly increased my mental toughness as it pushed my limits seriously, made me face difficult situations on a regular basis. I had to dive in the deep water with high levels of responsibilities, which I learned to handle reasonably well. It also allowed me to be familiar with coping techniques that we teach to our patients and to understand how our mind works in stress. So this participant was suggesting that the nature of their role meant that their mental toughness had developed. So it seems to be something that we can develop perhaps through experiential learning. But other participants in this study suggested the opposite pattern. So some of our participants suggested that their mental toughness had decreased due to a deterioration of their mental health. So these were participants who would describe their role as being very stressful, that having an important impact upon other aspects of their lives, such as their relationships with their family and so on. And they reported having poorer mental health. And then they suggested that because of that, their ability to approach new difficult situations had actually been reduced. So in terms of the insights into these more theoretical issues about mental toughness, I think this is a really interesting one, because it might suggest that there's limits to the extent to which our experiences can perhaps help us to develop mental toughness. So if on a daily basis we are experiencing difficult things and perhaps we reflect upon those and develop some insight, perhaps then we can develop our mental toughness. But at some point it might be that if we do have mental health and well-being difficulties and if we're very burnt out, then actually that might have a negative impact upon our ability to deal with other situations. So I'll draw some conclusions from the studies that I've talked about now, and then I'll also make some suggestions for future research as well. So one of the conclusions then is that mental toughness is a useful predictor of a range of mental health and well-being outcomes in first responders and also in other populations that of course might be at an increased risk of poor mental health as well. The MTQ-48 and then presumably the MTQ Plus as well could be a useful tool for identifying those at risk of poor mental health. And of course mental toughness could provide a useful framework for support or intervention. So if I was talking to people less familiar with the mental toughness concept, it would be at this point that usually I might make some suggestions about the implications of this and the kind of things we might be able to do to enhance mental toughness. That isn't necessary, of course, with you as an audience. We've heard some really great practices in the talks that we've had already over the last couple of days. So wouldn't it just be great if we could pick up some of those practices that have been used elsewhere and then use those in some of these settings? So use them with police officers, with fire officers, with individuals who are at a higher risk of experiencing difficulties as a result of their stressful roles. So there could definitely be potential to look at some of these things within these populations. I think we can also include that research with different occupational groups can provide theoretical insights about mental toughness. So some of these things that I've mentioned around whether we can develop mental toughness through experiential learning and also thinking about the direction of relationships between mental toughness and outcomes. I think these types of populations like first responders and other occupational groups where we have a lot of stress on a daily basis in these occupations provides a good opportunity to research some of these questions. So if we can look at populations where they experience a lot of stress in the workplace and we can see what happens over time, particularly longitudinal studies I think would be really helpful. We can perhaps get more of an insight into the role of that in the development of mental toughness. So this takes me on to some suggestions for future research. And some of these are actually things which we touched upon in the sessions yesterday. So hopefully this aligns quite nicely and follows on from that. So one of the things that I'm quite interested in at the moment is how mental toughness compares to some other concepts as a predictor of mental health and well-being type outcomes. So we know that mental toughness is of course related to some other concepts. So we talked about resilience yesterday and how sometimes some of the great work with mental toughness can be a little bit lost within all of the practices surrounding resilience. So I'm quite interested in showing that mental toughness seems to be a bit unique in the way that it can predict different outcomes. So there is a lot more work to be done in this area, but I have done one study which was published sometime last year. And that study involved looking at mental toughness and a well-being type outcome alongside self-esteem, grit and also resilience. And just to very briefly summarise the results from that, mental toughness was a far better predictor of these outcomes than these other constructs. So if you put everything in together as a predictor of well-being, you find that the best predictor and a unique predictor over and above everything else is indeed mental toughness. So I think this is really great for supporting the idea that mental toughness is of particular value and is something that we should try and grow in terms of research and practice. But it will be interesting to explore this with relation to other factors as well. So there were some interesting conversations in the panel session at the end of yesterday about how mental toughness might interact with perhaps other personality traits, or it may be that sometimes it's separate from these things, or that you get an interaction in terms of how it might then impact behaviour and other types of outcomes. The final point that I've got on this slide is then about exploring how self-reflection and insight can impact the development of mental toughness. So again, I was thinking about this one a little bit yesterday, and in the panel session at the end of the day, there was a little bit of discussion about this one. So it seems that there are two slightly different approaches used with mental toughness. So one is this idea that really what we should be trying to do is to develop an individual's understanding of their own mental toughness, as opposed to actually developing their mental toughness to make them more mentally tough. And the suggestion was that that can be really important, and even if people are mentally sensitive, having that awareness can allow them to be very successful. But then on the other hand, we've got a lot of intervention type work which is focusing on trying to develop or enhance mental toughness. So it is trying to make individuals more mentally tough. So I'm interested in these different approaches and about how self-reflection and insight links to mental toughness itself. So I think there's very clear evidence from a lot of your work that we've heard about that having an insight and an understanding of your own mental toughness is important. But actually, what does this really look like for individuals who are perhaps more mentally sensitive? So I collected a little bit of pilot data on this topic. I'm not going to talk about this very much because there's a lot of work left to do with this, and I haven't really conceptualised it very clearly myself. But it does seem to suggest that you get a relationship between reflection and insight and mental toughness, such that actually those who are mentally tough just have greater insight and use more reflection. So that's encouraging in a way in terms of developing mental toughness, but I think the question that would remain then is for individuals who are more mentally sensitive, is there something that can be done with self-reflection and insight that perhaps is a bit different, which doesn't develop mental toughness, but can still lead to the advantages perhaps that some training and support or intervention can offer. So there is some work that I think we can draw on from some other concepts. So the image on the slide here, this is not from my own work, so the reference is provided on the slide, but this is from some work looking at resilience. So it's just an image which suggests that self-reflection and developing insight into resilience is what can build the capacity for resilience over time. So the idea is that you get this cyclical pattern where if you experience a stressful event and then you reflect upon that develops your resilience, and then over time it can gradually increase. So I think thinking about this type of work using mental toughness, although it is somewhat separate from resilience, of course, which we noted yesterday, would be a really interesting way forwards.